Hi there, this is Dr. Priya Singh. I am a cosmetic dentist. I have a clinic named Impressionz Dental Care, which is in Mumbai, for the past 10 years. Okay, now tell me, what is that one thing, whether you have a small practice or a high-end practice, nobody can escape, and that is the bargaining patient. So today's video is all about that, how we can tackle such patients in our clinic. Now talking from my initial experiences, जब मैंने just clinic डाला था, I was really scared that if the patient is bargaining and if I don't give them discount, I would lose them. But with the years gone by, I have changed. Now I know how I should tackle them differently so that they are also not offended and I also don't have to give discounts to them. What is the first thing that the patient would tell you when you tell the treatment cost? Doctor, you're charging too much. Or he would tell you कि डॉक्टर दूसरे डेंटिस्ट तो कम चार्ज कर रहे हैं. They would compare you with other dentists. So what do? When I tell my treatment charge, I just don't tell the charge. I add the value for the treatment. I tell them why I am charging them that much without even they asking me. So when I tell them that my root canal is X amount, I always add that it's a single appointment treatment. Highly specialized equipments would be used. It's completely accurate, machine based, computerized. So when I say all those things, the patient immediately understands that even if he feels that you're charging them a little more, he immediately understands why you are doing that. Similarly, if I tell them bleaching materials, so I would tell them my materials are of higher quality. When they compare you with other dentists, do not demean the other dentist, but just say that every product is going to come in a range. Whether you buy a car or a shirt, you would get all the products in different ranges. So my price is this much because I use superior quality that is going to last long. There are products and crowns or materials which are of inferior quality also, but I don't do that personally. So when you say that, there is a chance that the patient would not bargain. Now here you have to understand the body language of the patient also. With the Indian mentality, sometimes the patient just gets offended because you did not respect that they are bargaining and you did not reduce the price. So there is a risk of losing such patients. So when I understand that even after telling everything the patient is still bargaining, I would just tell them that these are your treatment. Maybe I'll give you the cleaning or a scaling complimentary, or I would make the temporary crowns complimentary, something like this. When you would come for a follow-up x-ray, I would not charge you then, or else I can give them an installment facility that maybe during the treatment duration you can pay me in parts, but yes, I make sure that the first installment I take my investment in that. So that is very necessary. Now for the non-affording patients or my friends and family who expect certain concession out of me, I do give them concessions, but it's a percentage on the overall treatment. That is very necessary because if you reduce price on the individual treatment, there is a chance that they would go out and discuss it with somebody else, and there is a chance of the bad word of mouth spreading, because if two people have received treatment for different cost, so it can be bad word of mouth for your clinic. So don't do that. Give percentage on the overall treatment. So that is very necessary. So I tackle my patients who bargain like this. Hopefully it can help you. Do subscribe to my channel and also do comment. Take care.